Lacrimal apparatus. Lacrimal apparatus consists of secretory portion and drainage portion. Secretory portion is composed of lacrimal gland, which is the main gland of the lacrimal apparatus, and the accessory gland of cross and wolf ring gland. So lacrimal gland is a tubular alveolar gland which is present in the anterolateral position of the roof of the orbit. So if this is the orbit and here the eyeball is located, so it is in the anterolateral part of the orbit. Here the here the lacrimal gland is present. So lacrimal gland is in the anterolateral portion of the roof of the orbit in a lacrimal fossa. In the lacrimal fossa, it has a orbital part. The lacrimal fossa has a orbital part and a palpebral part, which is separated by a lateral part of the levator palpebrae superioris muscle. Levator palpebrae superioris muscle. The duct opens the duct of the lacrimal gland opens in a superior temporal fornix. The nerve supply of the lacrimal gland is facial nerve along with the parasympathetic nerve supply from the lacrimatory salivatory nucleus. Now the drainage portion. The lacrimal secretion ultimately drains into the inferior meatus of the nose. So it is composed of lacrimal puncta. The puncta is present in the medial canthus, 6 mm lateral to the medial canthus, in the which has a slight elevation, which is known as lacrimal papilla. It has two canaliculi. The canalicules are joined to the free surface of the posterior border of the free margin of the eye in the lacrimal sac. The lacrimal sac is present medially in the lacrimal bone in a fossa which is known as lacrimal fossa. This lacrimal fossa and this lacrimal fossa are different. The lacrimal fossa where the lacrimal gland is situated is in the anterolateral portion of the roof of the orbit, but in the lacrimal bone, the lacrimal fossa where the lacrimal sac is present, this is the lacrimal fossa. So it has a fundus at elevated end. It is 15 mm in diameter and 5 to 6 mm in wide. The canalicules have the vertical diameter of 1 to 2 mm and 6 to 7 mm in horizontal diameter. So from the lacrimal sac, the nasolacrimal duct opens. The nasolacrimal duct has an orbital part, intraosseous part and a intrameatus part, and it ultimately ends into the inferior meatus of the nose. It has a valve which is present in the distal end, is known as Hasner's valve. So the length of the nasolacrimal duct is 12 to 24 mm. It has an interosseous part, upper interosseous part and lower intrameatus part. So this is all about the lacrimal apparatus.